Welcome to Healthier Together, Larimer County's public health podcast, where we come together for healthier lives, connected communities, and real conversations. From your local public health team, I'm your host, Tom. Today, we're joined by Zac Hummel, Community Impact Manager at the Food Bank for Larimer County. Zac, thank you so much for joining us.
Yeah, good to be here.
So to start, can you tell us a little bit about your role at the Food Bank for Larimer County?
Sure. I am the Community Impact Manager at the Food Bank for Larimer County. And what that means is I oversee our various programs that we have in the community. So we work with about 100 different partners in the community who get food from us in various capacities. We have senior programs. We help with SNAP assistance. We have a variety of kids programs, one of which being the Lunch Lab.
So what exactly is the Lunch Lab?
Yeah, so we have a program over the summer that kind of falls into the bucket of our Fresh Focus for Kids. And that means that when school is out, we have the ability to step in and provide meals at no cost for kids, both who are attending camps, things like Boys and Girls Clubs, YMCAs, Northside Azatlan Center. And then we also have 2 different mobile food trucks where we drive around Larimer County, primarily Loveland, Fort Collins, and Wellington, and we get to distribute free lunches.
So how did the Lunch Lab get started?
Back in 2019 was the first year that we took the truck out. And really, it was a recognition of a gap in our community. There's some other providers in Larimer County who will provide lunches, but no one does it in the capacity of being able to travel around. And we had the ability to do that. And so we did.
So did it just start with the one truck and then you guys expanded from there?
Yeah, we started with one truck and then now we have basically a food truck, and then we have another van where we prepare all the meals ahead of time, put them in hot holds in the van, and then we can hand them out for kids.
Well, that's pretty neat. What are the eligibility requirements for getting a lunch through Lunch Lab?
The primary one is that kids have to be 18 years or younger, and that is a self-declared number. Other than that, there are no eligibility requirements. We don't require folks to provide an ID or proof that they live in Larimer County.
Oh, perfect. So I'm curious though, what kind of food do you guys serve through the Lunch Lab?
Yeah, so we provide all of the meals from scratch. We have a commercial kitchen in our food bank. And so we have a team of volunteers and staff every day who are producing these meals. And they are kind of a myriad of different options. Our kitchen manager really likes to try to keep things fresh and exciting. So you could see different kinds of salads on the menu. You could see honey mustard chicken, turkey tacos. The meal patterns that we follow is the same as what schools need to follow for kids when they're in school. So every kid has to get a grain. They have to get a meat or meat alternate, a fruit, a vegetable, and a milk.
So what kind of other activities does the Lunch Lab offer?
One of the really exciting things that we get to do, particularly in Fort Collins, is we've created a cohort called the Summer Mobile Program. The Summer Mobile Program is a group of nonprofits and organizations similar to us at the Food Bank who have a passion for connecting and reaching kids in our community. So in addition to the Food Bank, we have partners including the Bookmobile with the Poudre Library who will join us at stops. So kids will come, get a meal from us, and then sit around for story time. They can check books in and out there. So that's really helpful in some of our mobile home communities or neighborhoods that are a little bit farther away from the library, allowing kids to be able to access reading materials basically in their backyard is really exciting. The Museum of Discovery will come out and provide STEM activities or kind of exciting games or connections with their kind of work. Kids get little like STEM packets of things to take home to maybe like build a little model rocket or something like that. We also have the gardens on Spring Creek. As it gets to the end of the season, they'll have fresh produce that they can hand out to families that they've grown in their gardens. We have different CSU camps who will come out and join us. When kids come out to the Lunch Lab, they're going to get a free meal. They're also going to get some capacity of fun activities to keep them both well-fed and engaged over the summer months.
That's pretty neat. So where and when can people find the Lunch Lab this summer?
Yeah. So, as I mentioned, we have two different routes. So, every day we will be in Loveland and in Fort Collins. Our website, thelunchlab.org, easiest place to find us. We have a schedule. So, we are at parks, we're at each of the libraries, mobile home communities, a variety of places. Again, folks don't have to live in the housing complex or in the town where we are. If they're passing through, they're welcome to join us.
I am very curious. How many people has the Lunch Lab served?
Since we don't ask for any ID, we don't know how many unique individuals we serve in Larimer County. What I can tell you, last year we did just over 33,000 meals
Oh, wow.
over the summer. We go to 3 different stops every day on each route. And so a big day might be 80 to 100 people just at one stop. And then we might see another 40 to 50 at a couple other stops. So probably the biggest day we've had would be about 1,000 different individuals. But again, we distribute well over 30,000 meals over the summer.
Oh, wow. That's a huge amount of people.
It is, yeah.
So how is the Lunch Lab program funded?
The Lunch Lab is funded by a USDA program called the Summer Food Service Program. And so it's very similar to Healthy School Meals for All. So, in a way, that's another reason why I like to encourage families, parents, bring your kids out to see the Lunch Lab. We keep it low barriers, there's not an income requirement. Really, we see this as your kids get free meals during the school year. Over the summer, it's hard. You're taking your kids around, you're trying to find fun activities for them to do. Bring them out to the Lunch Lab. They can get a free meal and they can get connected with other community partners and meet new friends.
What does food insecurity look like here in Larimer County, especially for children?
It's a great question. Yeah, the data that we have tells us that there's just over 8,000 children in Larimer County who are food insecure. We know as a general broad number, about 12% or just over 43,000 people in Larimer County experience food insecurity. And so this program is really fantastic because we try to make it fun and exciting and really remove stigmas for families and kids that they can come out, no barriers, access a meal, and have fun together.
If people are interested in volunteering for the Lunch Lab or supporting the food bank in some other way, where can they go for more information?
As you can imagine, producing these additional 33,000 plus meals over the next 2.5 months is really a crunch and requires a lot of volunteer support. So we are especially looking for volunteers right now in our kitchen or individuals who might want to join us out en route to help us hand meals out and have fun interacting with kids. The best place to find that is on our website, foodbanklarimer.org, and then go to the volunteer section. And just note if you're interested in the Lunch Lab, and our team would be more than happy to get you connected.
So, Zach, thank you so much for joining us today. We really appreciate you taking the time.
Of course. Yeah, really good to be with you. And again, I would encourage anyone who's interested to learn more about the Lunch Lab. That is thelunchlab.org. You can learn more. You can see our routes. You can see the meals that are going to be available, learn about the partners who are with us, and come on out and join us.
Next, we're joined by Kimberly Baker, Larimer County's Health and All Policies Coordinator, here to provide an update on the 2026 legislative session. Kimberly, thank you so much for joining us.
Thank you for having me back.
To start, can you remind us what you do here at the Health Department?
Yes, so I'm the Health and All Policies Coordinator here at the Health Department, and I follow state and local and some federal policies to understand their impact on public health. We talked on the last episode that I was on that a lot of our health outcomes are impacted by the policies within our community.
What did this legislative session look like?
So the primary theme of the session was budget. There was a $1.5 billion deficit in the state budget, so there wasn't room to pass bills that had a fiscal impact.
How many total bills were introduced this session?
There were 626 bills introduced this session.
And I know you've mentioned in the past that there's a limit to the number of bills each representative can submit in a session. Did we hit our max number of bills this session?
Yes, we certainly did.
And how many of those passed?
449 of those passed, and that was about 72%, which is actually a little lower than what I've seen in previous session.
What percentage typically gets passed?
Usually 80, 85. It's usually a high amount.
So, last time we talked, there were a number of bills that we discussed that impacted public health in some way that I just wanted to get an update on. One of those was an expansion of cottage food law. What happened with that bill?
So that bill passed, and when I checked this morning, it's still awaiting the governor's signature, which we anticipate will happen soon. And we were able to get some public health protections in the bill, including a limit on the number of time and temperature controlled for safety foods a vendor can sell. So it'll allow a vendor to sell one item with up to 5 variations. So a vendor could make tamales and then sell them as beef, chicken, vegetable, and 2 other types if they wanted to. Additionally, the foods need to be packaged to be sold. And then there's also an educational requirement to take a course on food safety, which is already part of the Cottage Food Act, but this extends that course for vendors to learn about food handling and time and temperature control, among other things.
We also talked about some bills aiming to expand access to immunizations. What happened there?
So that bill passed early in the session and was signed by the governor in March. And the goal of that bill was to ensure that vaccine guidance in Colorado is evidence-based. It's kind of a response to some of the changes at the federal level where the vaccine recommendations have been changed and there's not necessarily evidence to back up those changes. So Colorado wanted to ensure that we are following vaccine recommendations that are evidence-based and come from places such as the American Academy of Pediatrics and other physician organizations.
We also talked about some efforts to expand access to mental health care, specifically a bill that aimed to offer 6 free therapy sessions to adults, similar to the I Matter program that's currently available for youth. What happened with that bill?
So that was Senate Bill 008, and it was lost. The bill sponsor resigned from the legislature in February, and there were other champions for the bill who continued that effort, but they opted to pull the bill to work on it in the interim period and bring back stronger proposed legislation next year. And part of this was to have a more robust stakeholder process for the bill, but the primary work they want to do is for the funding mechanism of that bill.
Were there other bills related to mental health care access that did pass this session?
Yes. So a bill that we followed closely was a mental health in sports bill. So it's called Alyssa's Youth Concussion and Mental Health Protection Act, and it requires coaches of youth athletic activities to complete biannual mental health training courses and to notify parents of mental health risks associated with concussions. So this is something that's already occurring in our school system. So now it extends into those private sports leagues as well.
We also talked about AI and data centers, and specifically their impact on our environment. What happened to bills that were related to that?
Neither of those bills made it through the legislative process. They were pulled by their bill sponsors as they were unable to get to a point where those bills would be able to pass and keep everybody comfortable with where they were at. And so I imagine we'll see similar bills return in the next session. But in the meantime, in Larimer County, the Board of County Commissioners are developing land use regulations to address the impact of data centers. And there's currently a public comment period open if anyone is interested in providing their input.
You mentioned that the state was grappling with a $1.5 billion budget shortage this session. And I know one of the potential proposed cuts was to local public health agencies. Can you tell us what happened there?
So this was a win for public health. There was a proposed $3.3 million cut to local public health agencies, and several joint budget committee members were not comfortable cutting local public health. Those members negotiated the cut to be $1.5 million instead of $3.3 million, which is great news for us as this particular funding source is flexible, which allows us to respond to local concerns quickly.
Was there other public health related legislation that came up during the session?
You know, we tracked fewer bills compared to previous legislative sessions. And so it was a little slower for public health than it has been in previous years. But there were several bills related to access to THC beverages, changes to alcohol sales, and reducing cigar taxes. Those bills failed. And there were several bills responding to federal policy changes that were introduced. Those bills had mixed success, and we mostly monitored those just in case they had impact to public health, which only one of them would, and we had no concerns about that one, and it happened to be the one that passed.
Are there other bills that didn't pass this session that you expect to see come back in the future?
So I certainly expect to see the THC bill come back.
When does the next legislative session start?
January 11th, 2027, and it'll be a different vibe. We'll have a new administration in the governor's office, and several other high offices will have some new folks. And then there's always some legislators that are term limited, so we'll have some new replacements for those folks.
After catching your breath, what will you be working on during the break in between?
So I'll be working on tobacco prevention and cessation policy at the local level, and I'll be monitoring the federal budget process. And then in the last days of the Colorado legislative session, a bill was passed to establish a Medicaid commission to review Medicaid spending utilization and administration. And Medicaid is a big portion of the state's budget, so they're trying to figure out how to potentially rein in some of those costs. So that commission's report is due in December, and I'll be following that process closely. And I'll also do some work with the Colorado Association of Local Public Health Officials and some partners at other public health agencies regarding the implementation of the Expanded Cottage Food Act. And of course, we'll be preparing for next session.
Awesome. Kimberly, thank you so much for joining us.
Thank you for having me.
Do you have a question about public health in Larimer County or a topic you'd like us to discuss? Let us know. Email us at healthiertogether@larimer.org. Thanks for listening, Larimer County.
Until next week, stay well, stay connected, and remember, we really are healthier together.